The air we breathe. In normal times, it's something we can take for granted. But like so many things, coronavirus has changed that. Air conditioning systems are suspected of a role in a series of outbreaks. Now businesses are going to extraordinary lengths to reassure us that their air is safe. Nowhere is that more the case than in the skies, with passengers packed together taking in refiltered air. So what will it take for us to breathe easily again? With summer on the horizon, many of us will be tempted to switch on the air conditioning to cool down. But recent insights of a Harvard infectious disease expert suggest that air conditioning use across the southern United States may be a factor in spiking COVID-19 cases. Plus, a coronavirus outbreak in a German meat plant was also linked to cooling systems. So, how safe is the air we are breathing?
A common sight for these coronavirus times, people pouring off public transport, wearing face masks, looking for that first gulp of fresh air. Masks in many places are compulsory, but as the weather gets warmer, is that enough to ease worries?
I feel if I have a mask on my children and I try to make sure that I'm like 1.5 or 2 meters away from somebody who also has mask, I feel quite sure.
Obviously it can't be too safe, but if you want to get around, this is what you have to do.
Most modern trams and buses are fitted with air conditioning units which draw fresh air from the outside. But go underground and it's a slightly different story. Though passenger numbers are still down compared to before the pandemic, carriages are starting to fill up again. Unlike trams and buses, most underground systems around the world don't have air conditioning, and so in confined spaces without much ventilation, these are considered higher risk. Despite the lack of air conditioning, transport officials point to other sources of airflow.
So they use a lot of outside air to ventilate the vehicles the whole time that they're going and they're driving. Then, of course, at the stations, the doors open up, so you have ventilation there. The stations itself are ventilated by the trains going back and forth, because you have these huge trains pushing in with their speed, moving out the air.
A coronavirus outbreak at a meat plant in northern Germany has put air conditioning under the spotlight again. It follows a Chinese study that suggested air conditioning helped spread the virus to diners in a Guangzhou restaurant.
If the air condition has a movement of the air, they can transfer the droplets of the viruses from one to another. Therefore, you need much more air, fresh air from the outside in such cases.
Scientists admit it's too early to make any firm conclusions about air conditioning units. As well as fresh air, they say high-efficiency filters can help reduce the presence of the virus. Such filters are what airlines use inside their cabins, recycling the airflow every 3 or 4 minutes. But this only kicks in during the flight and not before and after.
These air conditions has to be active before the passengers enter the plane. We think that dry air promotes formation of aerosols and consequently the possibility of an infection.
As summer and the holiday season approaches, this year there's more than simply just the destination to consider.
Well, for more, let's bring in Yan Chan. He's a mechanical engineering professor at Purdue University in the U.S. state of Indiana and the editor-in-chief of the academic journal Building and Environment. Welcome to DW, Yan. The scientific community seems to be undecided when it comes to air conditioning systems and the coronavirus. Do you think they are safe to use during a pandemic?
Thank you very much, Chris, to have me here. The air conditioning system in general, I think, is very safe. However, the air distribution, leaving the air conditioning system and in the buildings, in the airplanes, and so on, could propose a certain type of risks.
Okay, can you tell us how and why?
Yes. Well, for example, when you cough or when you talk, you generate a lot of droplets. And those droplets will go within the air inside of an enclosed space. And this typically will wander for about 3 to 4 minutes in the airplane and 10 to 12 minutes in buildings. And this droplet will be there, and then you will breathe in if you stay in the same room with a sick patient. And then you might could get this COVID-19.
Okay, now airlines are saying it is safe to fly because they use special filters, which the airlines claim clean almost 100% of the air aboard a plane. Is that true?
Yeah, it is true that the airplane usually high efficiency particulate filter or HEPA filter, which can filter out particulate with a diameter of 0.3 micron or larger. So in principle, you can filter out all the viruses in the air. However, the infection could just occur inside of an airplane. So before the air is being sucked out by the air conditioning system, as I just mentioned, during these 3 to 4 minutes, you have a very high chance to get infected.
Okay, when it's about the filters that are key here, can they be used in other places, like public transport, like office buildings?
Yes, in principle, these HEPA filters can be used in any air conditioning systems. However, that's a problem because when you use a HEPA filter, then you need a very powerful fan in order to push the air through. Now, most of the buildings, public transportation systems like train, buses, or subways, they are not equipped with this powerful fan. So when you use a HEPA filter, that means that you will have much less air. So that's also a dilemma to use the HEPA filters, unless you really make an overall change to have a very powerful fans there.
Okay, are these fans being worked on to integrate them into regular air conditioning systems?
In the air conditioning systems, we do have normal fans, but those fans typically only work together with the low efficiency filters. And the low efficiency filters typically installed in the buildings are normally good because if there's no pandemic, you have no problem with that. But during the pandemic, of course, you have a very small virus and which could be recirculated in the air conditioning systems, and then you might not be able to stop that.
And Jan, in general, when it comes to air conditioning, what can companies do to lower the risk of infection for their employees working in offices?
Yeah, that's a great question, Chris. The first thing you definitely want to do is to see you can install a high efficiency HEPA filters there. And I doubt because it might not be possible. Then the second way, if you have to run the air conditioning systems, I will recommend that you use 100% of outside air because outside air is unlikely to contain any COVID-19 virus. So you supply just outside air will be very safe. Furthermore, if you could open the windows, that will be great because natural ventilation is very good to reduce the concentration of the virus inside of spaces. And you could also consider to buy a HEPA filter inside that type of air cleaner because those type of air cleaner is also very efficient in getting out of the particulate and droplets.
Jan Chen, mechanical engineering professor at Purdue University. Jan, thank you for your insights.
Well, thank you very much, Chris.
And now it is over to another expert in his field, our science correspondent, Derek Williams, answering the questions you sent us.
I've heard different numbers for the longevity of SARS-CoV-2 on different surfaces. What's the scientific evidence behind it?
Almost all of the citations you find about numbers in this area eventually lead you back to one study that was published in mid-April in the New England Journal of Medicine. The researchers behind it conducted a series of tests with SARS-CoV-2 on surfaces made from different materials, and their findings have been widely accepted as guidelines since then. the scientists concluded that the virus was most stable on plastic, where it was still viable, at least in small amounts, after 3 days. That's followed by stainless steel, where it was still measurable after 2. On cardboard, on the other hand, it was no longer detectable after 24 hours. Those figures are roughly consistent with what had been observed about viability in a related pathogen, the coronavirus that causes SARS. And they've now been widely accepted as a rule of thumb. I haven't seen any further research disputing them.
So how dangerous are surfaces? Do we need to disinfect everything that comes into the home?
So if the virus can remain viable for up to 3 days on some surfaces, how much of a threat do those surfaces pose? Objects that have been contaminated and later transfer a disease are known as fomites. And there's been a lot of discussion about how big a role they're playing in the current pandemic. Increasingly, though, the consensus is that fomite transmission is the exception rather than the norm. That's because a whole sequence of events has to happen for it to occur, starting with the smearing of significant amounts of the virus on a surface by someone who's infected, when the clock starts ticking as it begins to lose viability. Frequently touched surfaces like doorknobs or elevator buttons pose more of a threat than, say, a carton of milk from the store. But even if you pick the virus up on your hands, you still have to actively transport it to your face within a certain time frame and not wash your hands in the interim. In comparison, you just have to be close enough to someone shedding the virus as an aerosol and to breathe it in and to catch the disease that way. So most experts and health authorities say now that although fomite transmission is possible, COVID-19 spreads much more easily person to person.